Our group study is entitled R.O.A.D to Recovery, Responding to the Opioid Abuse Dilemma. So we're going to start off by asking the question, what are opioids? Opioids are pain-relieving medications that can be both naturally occurring or synthetic. Naturally occurring opioids are called opiates and are derived from the opium poppy plant. Some examples include morphine and heroin. Examples of synthetic opioids include oxycodone and Percocet. So how are opioids used medically? Opioids are prescribed by doctors in most cases to alleviate pain. Opioids can also be used for anesthetics, cough suppression, and bowel control. Side effects can include drowsiness, lethargy, decreased breathing and heart rates, and sometimes death. So how do opioids work in the brain? Opioids attach to receptors in your brain which trigger an enormous release of dopamine. This causes a feeling of euphoria in the body. As opioid use continues, the body's ability to release and respond to its own dopamine is suppressed. So how does medicine become abused? The patients are prescribed opioids to treat pain, and they use the medication, and not only are the patient's pain symptoms gone, but they feel better than ever before. Patients continue to chase this euphoric feeling, leading to increased use of opioids. This increased use of opioids leads to decreased ability of the body to release and respond to its own dopamine. And without dopamine, the patient is depressed and is willing to do anything to achieve that high. Now we're going from abuse to overdose. As tolerance for these drugs increases, more and more opioids are needed to achieve that desired feeling. At low doses, opioids can cause lethargy, but as dosage increases, breathing rate and heart rate both decline drastically to a point that could be fatal. So why are we deciding to focus on this opioid epidemic? Every 12 minutes, someone in America dies from an opioid overdose. 115 opioid overdose deaths every day. Every day, 1,600 young adults misuse an opioid for the first time. 1.9 million Americans live with an opioid dependence. Dependence on opioids can occur just after 5 days.
They gave me Vicodin after my knee surgery. They kept prescribing it, so I kept taking it. I didn't know it would be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
So as you can see, this is a serious epidemic that we need to focus on immediately. So our study focuses on young adults. Why is that? Adolescent and young adults tend to engage in risky behaviors such as impulsive drug use. Early use of prescription drugs leads to a greater drug dependence later in life. So if we catch it early, we can stop it from happening later. 22.7% of young adults ages 18 to 20 use drugs. 21.5% ages 21 to 25. These are astounding numbers that we need to reduce greatly. So our study focuses on the region of North Georgia. Why did we choose that region? Opioid abuse has the greatest effect on rural areas. This can be attributed to social, economic, and structural characteristics. Isolation and self-reliance can negatively affect care-seeking behavior, as well as multiple barriers, such as perceived stigma, cost, reassurance of confidentiality, transportation, and availability of treatment centers. So why are we doing this study? First and foremost, to expand the knowledge and awareness of opioid use in society, to improve treatment and intervention methods, to bring awareness to the malpractice of opioid prescription, to help identify the symptoms of opioid abuse among young adults ages 18 to 22, and to spark further research. Our intervention setting is going to be colleges and universities in the North Georgia region. Our target population we're trying to reach is young adults ages 18 and 22 in the North Georgia region. But our study isn't strictly college students. It's open to both college students and young adults in the community. We're going to be partnering with the North Georgia Department of Public Health, the Center for Disease Control, and the North Georgia Drug Rehabilitation Center in this study. So the R.O.A.D to Recovery program, we're going to be going onto these college campuses and we're going to be conducting a 30-minute presentation for them. After the presentation is over, we're going to be going into a 30-minute small group discussion. We're going to host this intervention at a different college or university in the North Georgia region every week throughout the month of March. We're going to start with the University of North Georgia, followed by Young Harris College, Piedmont College, and ending with Covenant College. We're going to host the intervention daily, Monday through Friday, on the specified campus from 8 o'clock to 9 o'clock p.m. This will give all people in the area an opportunity to attend the program regardless of their schedule. So our study is going to be a prospective cohort study. We're going to be, as you can see, on the day of the intervention, a study is going to be given out to each audience member containing questions about their individual opioid use and/or exposure. So we're going to be comparing the baseline data from our program participants and the data from our program participants 1 year, 2 years, 3 years, 4 years, and 5 years after the intervention. The survey is also going to include a section for contact information so we can keep contact with them in the future. We're going to check in with our participants once every year, emailing them the same survey, observing any differences, negative or positive. We'll follow the participants for 5 years following the intervention. So our sample size is going to be dependent on the attendance of our presentations. We can't control that, but based on a p-value of equal to 0.05 and 95% power, it would take a minimum of 950 participants to see any statistical difference. We're going to evaluate the success of our intervention program by comparing the data we collect from our cohort at baseline to the data we collect from the cohort 1 year, 2 years, 3 years, 4 years, and 5 years post-intervention. In order to measure our outcome, we will compare the prevalence of opioid use in our cohort at baseline and the prevalence of opioid use in our cohort 5 years post-intervention. If the prevalence is significantly lower at an alpha value of 0.05 at the conclusion of the study than it was at baseline, then we will consider our intervention a success. Now here's a sample of our opioid use questionnaire that we will be sending out to our audience members annually, including a bunch of questions about their opioid use and exposure to opioids, as well as the contact information section at the top. And then here we actually have what our presentation will look like at our R.O.A.D to Recovery events on the college campuses. So as you can see, it's a lot of the same information describing what opioids are, how they work, how they can become dangerous and even fatal, some facts specific to the state of Georgia, trying to address the addiction stigma and show that it's not just a specific type of people that have addiction problems, it's anybody, including celebrities. And then bringing the truth of that addiction. Then bringing up treatment methods that these people can use if they are struggling. And then finally wrapping up with how do we end the epidemic. We want to prevent new cases of opioid addiction through education, outreach, and prevention programs. We want to provide interventions and easily accessible treatment for those that do have an addiction. And we want to push for legislation to prevent overprescribing of opioids as well as black market availability of opioids. And then we want to finish up with any questions that the audience may have. Finally, our references. And then as we said, we're going to break out into small groups at the end of the presentation. So they'll have 30 minutes. They're going to break up into groups of 10 and they're going to discuss the following questions so they can learn from each other and learn from each other's experiences. Thank you guys for listening. I hope you enjoyed our project.